Jared in Downingtown, Pennsylvania. Hey, Jared, what's on your mind today?
Hello, Tom. I want to go back to healthcare in a bit that you were previously talking about. There was a good pamphlet in the Russian Empire in the 18th century. It was called "What Is to Be Done?" And now this is a Revolutions podcast I'm listening to about the Russian Revolution. Basically, when the French Revolution happened, the Enlightenment ideas spread across all of Europe. But in Russia, where they did have Enlightenment ideas, where it flourished under Catherine the Great, they became very reactionary afterwards, after the French Revolution, and began just, purging the government. They supported all kinds of reactionary revolutions across the world. And Lenin actually cited What Is to Be Done as the pamphlet that he wanted to, that helped radicalize him. He actually came up with his own What Is to Be Done pamphlet to the situation that was currently in Russia. And if we look today, what our situation is, we're kind of very similar to what the Russian people were under the Tsar in the 18th and 19th century. In a lot of ways, you could say Trump and basically imperial presidency in general is the new Tsar for us. They're supporting reactionary counter-revolutions across the world, and domestically they're clamping down hard right. And with healthcare, I view this just as another struggle of the working people across the world. And if we don't start adopting a more materialistic world of the world, dialectic materialistic world, view of the world of Karl Marx and Engels, and a anti-imperialist stance like that Lenin had, that he adopted, then I fear that we're not going to survive as a species, because if you look at climate change, ecological, and everything else, healthcare does factor into this. And a more egalitarian world would be a less polluting world. But around the world, we're seeing counter-revolutions all around the world, and the liberals in our country are basically the liberals that supported keeping the Tsar, but wanting to put the less bad aspects of it, bludgeoning the regime. And the reality is you had to get rid of the regime. I mean, it was a nightmare living under the Tsar. There was no democracy. Jews were being pogromed, forced to live in the Pale of Settlements. That's why they were Holocaust.
I get all this, Jared. We just have 20 seconds. What's the bottom line? What's the point you're trying to make?
The point is we need to stop advocating for affordable health care. We need to advocate the complete free health care, the complete nationalization of the healthcare industry. That we shouldn't have to, it should be a right.